Hello. My name is Charles, and I'm here to tell you about lumbar spinal stenosis. What is lumbar spinal stenosis? Lumbar spinal stenosis is a condition in the spine, which occurs primarily related to the degenerative changes, which occur with aging. First of all, the neurocanals, which are the holes next to the spine, where the nerves come out of the spine, and connect to the muscles and organs. One of the problems is when over time, as we have narrowing of the vertebral discs, the spaces in between canals start to narrow, and begin to get smaller and smaller, after which, it would start to pinch down the nerve, which has almost the same symptoms with disc herniation. What are the things that must be done, should you have lumbar spinal stenosis? One of the things you should make sure of, is to have adequate hydration in your diet, so, make sure you drink enough water. Adequate hydration can help hydrate the discs, and prevent further loss of disc, which will eventually contribute to further narrowing of the canal. Another thing to do, is to avoid excessive extension, which includes an anterior pelvic tilt, that can increase the arch in the lower back, increasing the pressure on the nerves based on how the canal is closing. What are the types of lumbar spinal stenosis? There are two types of lumbar spinal stenosis. The first type is the one which occurs in the central part of the spinal canal, or the hole through which the spinal cord runs. The other type is called the lateral spinal stenosis, or the compression of the nerve, which occurs most usually to the side. The most common area of the spinal stenosis is in the lumbar spine. The most common level of lumbar spinal stenosis is between the third and fourth lumbar vertebrae, and as well as the fourth and fifth lumbar vertebrae. As we begin to age, we begin to develop the degenerative changes of the intervertebral disc, or the lumbar disc. There are many changes which occurs, and the first one is the disc begins to soften, and begins to squash out. It also begins to bulge out in the back, causing a natural ruptured disc, or herniated disc, or a bulging in the center of the disc, which then compresses the nerve roost in the lumbar spine, of the spinal cord in the neck and upper back. It can also then, if this disc rupture is off to the side, may cause pinching of the nerves, as it leaves the spinal cord. Another important anatomical landmark, which is also very important to discuss, is the hole in the spine, where the nerve exits from within the center of the spine, is called the neuroforamina, which occurs at every level, so that the nerves can exit at every level, or segment of the spine. The narrowing of the hole is called neuroforamina stenosis, and consequently, we have central stenosis, which occurs at the center of the spine, lateral stenosis, which is a little off from the center, and foraminal stenosis. Each of the type of compression, central, lateral or foraminal on the nerve, can cause distinct symptoms.